everyone. Welcome to the seventh episode of Breakfast at UMHealth today. And we're going to have two clinical departments event today, and we're going to have two topics. One from the Department of Obstetric and Gynecology, and the other one will be on orthopedics department. So we are pleased to have Dr. Vimaladevi Annamalai, who is one of our academic staff in the Department of Obstetrics and Gynecology, who will be talking on the pulse of an Asian woman. And we hope that we're going to learn something, and we want to find out what is the pulse that the Asian women have. And Dr. Vimala will be is also one of our alumni in University of Malaya who has masters in obstetric and gynecology from the University of Malaya. Without further ado, we welcome Dr. Vimala to deliver her talk. Over to you, Vimala.
Good morning, everyone. I'm Dr. Vimaladevi. I'm extremely sorry for the video. I've got some technical problem here. Otherwise, today we're going to talk about the pearls of Asian women. I am Dr. Vimaladevi from the Obstetric and Gynecology Department, medical lecturer here. For those who are wondering what's the pearls of Asian women I'm going to talk about, and for those who have already guessed it, yes, I'm going to talk about the polycystic ovarian syndrome. Why this polycystic ovarian syndrome? It's because the string of pearls sign, which is seen in the scan finding, that shows exactly like a string of pearls. So I chose this as my topic. Reason why? It's because obesity has been increasing tremendously recently in Malaysia. And I think PCOS, we need to create awareness among all the women. Think about PCOS. PCOS is one of the most common endocrine disorders in women. It's a chronic anovulatory infertility and hypoandrogenism. What we mean as chronic anovulatory? So in a normal woman, we have an ovulatory cycle where you have a regular, normal monthly menses. In this case of PCOS, they tend to have oligomenorrhea, in the meaning that they will have a scanty menses in about 3 to 6 months, even sometimes yearly. So as a result of anovulatory, it causes infertility, difficulty in conceive, Susanna pregnant, and causes hyperandrogenism, where the patient will have hirsutism and acne. Why this is important for us to know? Because the prevalence can be as low from 2.2 as high as 26%, and especially with the blooming of obesity now among us. How do we diagnose? For those who are already in ONG and those who knows Rotterdam consensus criteria, yes, we are still following this. What is Rotterdam consensus criteria? PCOS is always a diagnosis of exclusion, where the diagnosis is confirmed by 2 of 3 criteria after exclusion of other etiologies. So oligo and ovulation is one of the important criteria. So menstrual history is very important when the patient comes to us. And secondly, it's a biochemical and clinical sign of hyperandrogenism. If the patient has acne, hirsutism, acanthosis nigricans, and we take their blood result, it shows a high total testosterone. And thirdly, importantly, to my topic, it's the ultrasound finding polycystic ovaries. So there are few other criteria which is available, and it's good to know, but we universally still using Rotterdam criteria to diagnose PCOS. Pathophysiology of PCOS, this kind of a wordy slide, but I just would like to highlight the risk factor to it is sometimes genetics, obesity, sedentary lifestyle, intrauterine androgen exposure here. Eventually, it causes insulin resistance. So the important pathophysiology of PCOS is hyperinsulinemia, where the insulin resistance acts on various organs. And importantly for us in ONG is this ovary. So this causes ovulatory dysfunction leading to follicular arrest, in the meaning that this patient will have multiple follicles giving polycystic ovarian morphology, but it's just not maturing. And at the same time, it causes increased androgen level, causing all the other symptoms and reduced sex hormone binding globulin levels in the liver. So how does this patient present? And some of the patients who are not coming to us, All right, if you have any of your friends, your colleagues, okay, your sisters, whoever have this problem, please highlight that you may have a PCOS symptoms. All right, first, excessive body hair growth, weight changes in the meaning that they have trouble losing weight, it's just increasing, low sex drive, irregular or missed periods, they've been having monthly, not a monthly menses, male pattern baldness, thinning of hair, mood changes, acne, fatigue, and high testosterone levels. And importantly, some will have trouble in conceiving, difficulty in getting pregnant. So if you come to us, these are the investigation importantly we will do, and we will try to exclude other diagnoses too at the same time. Important to diagnose PCOS will be the serum testosterone, free androgen index, sex hormone binding globulin, and to exclude other problem, we would also take thyroid stimulating hormone, prolactin, LH, FSH, and other hormones which are appropriate to it. Why? There you can see the oral glucose tolerance test and lipid profile. I'll talk about it. What is the complication of PCOS, which we will also take it as a baseline when this patient come to us. This is ultrasound features that I'm talking about. In a normal ovary, you can see about 6 to 10 follicles, and usually one follicle will mature to help a woman to get pregnant, or if not, it comes out as a menses. But in this PCOS, if you can see, it's multiple PCOS, and it's just not maturing, not helping the woman to do anything actually. So why do we need to know about PCOS? Why am I talking about PCOS now? I would like to emphasize that PCOS is not just a disease as it, it's actually a lifelong disease. Some women experience it as early as 15 years old, right? So when a teenager has a problem of menstrual irregularity, and we have a daughter who's having oligoanovulation, if you look at her face, she's like having an acne, hirsutism, please come and see us and seek for treatment. It's always better to prevent and cure this disease early. And there are some of them who actually just leave it as it is, like, oh, it's okay, it's just early menses, it will get better. And subsequently, it goes and affects the reproductive age group at the age of 25 to 30 years. At this point of time, some women will experience having difficulty in conceiving, infertility, and even those who got pregnant will have pregnancy complications like GDM, all right? And even at this point of time, it's always good to come and see us and get treatment. And some women will just leave it and live with it. I'm having menses every yearly, I'm good with it, I'm happy. So as a result, it eventually causes metabolic disorders because of hyperinsulinemia that I've just spoke about. It causes them to have diabetic, cardiovascular disease, dyslipidemia, and eventually for the menstrual that I've been always talking about, it will eventually causes endometrial hyperplasia, in the meaning that your endometrium gets thickened over the years. There's no menses coming up every month, leading to changes in your endometrium. These changes will eventually cause us precancerous as it goes and eventually lead to endometrial cancer. So it is really important for us to know why PCOS can be as harmful as it is. So complication of PCOS, I put it in a nutshell here. Infertility, difficulty in getting conceived, endometrial cancer due to continuous exposure to high levels of estrogen without progesterone causing endometrial hyperplasia. Means easily, we are not getting menses every month. So diabetes mellitus, you are very high risk. Obesity, more than 50% will have diabetes or pre-diabetes before the age of 40 years old. And when you're pregnant, you have high risk of gestational diabetes. Heart disease, yes, we women, we have risk of heart attacks 4 to 7 times higher when you have PCOS. Hypertension, yes. Dyslipidemia, elevated levels of LDL, which you call it as a bad cholesterol. Sleeping apnea when you have obesity, anxiety and depression because you have so much of problem, you become depressed in life. Strokes, weight gain, and eventually if you get pregnant, you can have complications such as miscarriage. I would like to talk about obesity, just a 2 slide, all right? Just would like to highlight, we Malaysians, we are about 30.4% overweight and about 20% are obese. We are actually leading, and Malaysia is the first in Southeast Asian adult obesity prevalence with 15.6%. And what is so sad about it is we women, 54.7%. That's quite high. And if we see even our kids, some of them, about 30% of children aged 5 to 17 are overweight and obese. This is really not good. And why obesity? I'm going to tell this because I want everyone to calculate your BMI today and to know where do you stand today as an Asian, and are you overweight, obese, or proudly saying I'm actually normal weight. It's very important for us to know this because this is the first step for us to get a good, healthy lifestyle to reduce all the other complications that could happen in the future. So going back to my PCOS, can it be treated? Yes, it can be treated. So management-wise, it's very easy management of PCOS actually. When it comes to us, once we actually diagnose you as PCOS, usually we'll recommend healthy lifestyle. It's easy to say healthy lifestyle, but there are few steps that you can follow and it really helps you. Regular exercise, healthy diet, which I'll talk about what is the good diet for PCOS. Hopefully this can help some of you out here. Weight control is very important. I'll talk about it too. And if those who are smoking, please kindly quit smoking because it have higher levels of androgens. Medication for those who wants to get better with their weight, metformin, OCPs can help with menstrual irregularity, and surgical treatment mostly towards infertility patients. So talking about the diet, the best PCOS diet, I feel like this will be very useful for some of us. Dairy-free. Okay, remember that you have to take something dairy-free. Dairy can increase estrogen and inflammation in the body, so can reduce the milk intake. Lean protein, all right? Fish, egg is good because protein can help stabilize blood sugar level. Fibers, okay, take a lot of vegetables because it helps to balance hormones and blood sugar level. Gluten-free, try to reduce whatever is white. Don't take bread if possible because it can increase inflammation in the body. So reduce sugar, the same thing goes. White, don't take. Sugar increases inflammation and insulin resistance and makes this PCOS even worse. Inositol is actually a good supplement which improves insulin resistance. It's proven and it's actually very good. And even in some of infertility patients, we do recommend them to take all these supplements. So there are also natural ways to improve insulin resistance in PCOS. It's just not about trying to lose weight, all right? So it's like you have to have a good, yet 7 to 8 hours of sleep at night. Even though it's just a sleep, no, it actually means a lot to your body, all right? Your body need to regain back, all right? And then break up with sugar, like I said, no sugar if possible. Manage stress, try to lead a stress-free life. Go for yoga, go for exercise, all right? And eat a lower carbohydrate diet, like I just said before this. Do you know that if you lose weight, it's so good for your body and also for this PCOS? A reduction as little as 5% of your total body weight has been shown to reduce insulin resistance and testosterone level, as well as improving body composition and cardiovascular risk. So remember that prevention is always better, right? So why not we try to reduce as little weight as we can to get a better life? So management of PCOS, like I said, usually lifestyle modification. And if those who are not planning to get pregnant, then we can give them the COCP to regularize the menses. And sometimes we can give Dian 35 to reduce their acne, hirsutism, in addition to regularize their menses. Metformin and spironolactone may help. And for those who want to pursue pregnancy, yes, of course, we can help you. We have a lot of medications like ovulation induction agents to help us to get them to get pregnant. Okay, if we talk about PCOS, it's not only an OB-GYN problem, it's not only by us, but it's actually a multidisciplinary. If we see throughout, the patient will have lifelong disease, which will end up having a lot of medical problems. So we need medical help. So when we diagnose them to have diabetic hypertension, we will refer them to a medical personnel. So metabolic screening and intervention. And for dietary, we do help them for nutritional counseling. Some of them who have so depressed with their life need help. We do refer them for psychological and behavioral support. For those who came to us just for irregular menses and subsequently noted to have fertility problem, yes, we do refer to ERT, all right? And some of them who needs treatment for hypoandrogenic symptoms like acne, hirsutism, yes, we only treat that too also. So endometrial protection, yes, we do treat, and we also do the surgical management if needed. So this PCOS patient, even though it seems like an easy disease, it's just a PCOS, but eventually the patient will suffer a lot of problem. So it is really, really important for us to know what is this PCOS and what does it cause for a woman. So why bariatric surgery? That I'm not going to tell bariatric surgery because we will work together with surgeons also. In those women who's actually watching this, who's seeing this, might be thinking, you know what, doctor, you're talking about so easy to reduce weight. Okay, if you ask me, so easy to reduce weight for those who are morbidly obese. All right, for those who have morbidly obese women trying to lose weight still cannot. All right, with PCOS, with the obesity of 40 kilogram per meter square or 35 kilogram per meter square, and has a lot of high risk obesity related complication, yes, we can offer you a bariatric surgery. What is bariatric surgery? It's actually a gastric banding which is applied, and this will help to reduce weight, especially for obese women. So everything has risk and benefit. Obviously, if you do a bariatric surgery, it induces a significant weight loss up to 60% of excessive weight. And all the other complications like diabetes, hypertension, dyslipidemia, reducing mortality from cardiovascular disease and cancer compared to lifestyle modification. However, have to remember that every surgical management has its risk, include about 0.2 to 1.1% of mortality rate, bowel obstruction, infection, esophagitis, and nutritional abnormalities. And with a lot of we have a lot of new medication that's coming up to help us to reduce weight also. If you have any question on that treatment, please kindly visit us in ONG and would like to help you with that too. So I think I've come to my end of my slide. So the reason why I present on PCOS is to create awareness of what is PCOS. And if you have the symptoms of PCOS, please come and see us. We will try to help you. We OB-GYN here are always ready to see and help every patient that has problem. Remember, health is wealth. Prevention is always better than cure. So it's always better to prevent than a complication happen. Thank you very much.
Thank you very much, Dr. Vimala, for the short and sweet CME on the PCOS. So I hope that all the 100 over participants today now understand what are the pearls of the Asian women. It's not necessarily a good thing to have pearls in your ovary because it actually indicates that you probably will have polycystic ovarian syndrome. There are a few questions in the Q&A, but before we start, I just remind everyone who have a question, because we got quite a lot of time until 8:30 to discuss this. So you can actually type it in the Q&A box, not the chat box, but the Q&A box, so we can actually read the Q&A and hopefully that we can answer all the questions. As you have listened to Dr. Vimala, the definition of obesity now has actually reduced to 27.5 kilogram per meter square, as if of from the latest guideline of the obesity, Malaysian obesity guideline. So we no longer use 30 kilogram per meter square as the obesity or overweight. So obesity type. So we are using 27.5 kilogram per meter square. So there is a question here, Vimala. So are we moving towards the multidisciplinary integrated management of PCOS in this country, or is the service provision currently still operating in silos? Do you have an answer? Because yeah.
Yeah, I think, Prof, we should move towards multidisciplinary because this patient eventually, if you see, it's a lifelong disease. And I think we are trying to get every team on board when we are treating these PCOS women, especially here in Yes, we do.
Yep. So just everyone in UMMC, we are trying to get the MDTs clinic involving us, endocrinologists, and pusat sukan, the Promnahas department or before the COVID. So it was actually start after the COVID. So we receive a lot of referrals for irregular menstrual problem and also infertility. And we are the department that actually have the first contact of these kind of patients. So we, if it is, we can manage it ourselves, so we can manage it. But some of these patients, even though with dietary and lifestyle modifications, still unable to reduce their weight and still having irregular menstrual problem and also concomitant diabetes mellitus. So we are trying to get the MDT clinics with the endocrinologists and the sports medicine to have a multidisciplinary clinics, and we will announce it once it's already running well. So we have like an ad hoc, but it's not really regular. So we are trying to get it a multidisciplinary clinic soon. So the next question, Vimala, is recognizing its importance as a health condition in the population. Is this being delivered and integrated, or is the same thing? Also, in the in a medical curriculum and undergraduate. Yes, I can answer that. So we are teaching this for the medical students. So therefore, we encourage medical students to listen to this CME today, to listen on the PCOS. So this is the common condition in gynecology where it has to be known by medical student levels, and also need to be referred appropriately to the gynecology department. Of course, I think if you look at the Rotterdam criteria, they actually trying to get out of laboratory diagnosis. As you know, that the Rotterdam criteria is only clinical diagnosis. They only look at the irregular menstrual problem, and then the hyperandrogenism by clinical, and ovarian polycystic ovarian morphology. So we need to have 2 out of the 3 to diagnose the polycystic ovarian syndrome. So I think all the medical students should know how to diagnose it, what are the criteria, and it's part of our end of posting question for PCOS. And Vimala,
Yes,
the
Prof.
one question is, what is the possibility of pregnancy rate of PCOS patients that undergo IUI treatment?
Okay, I think I will take this question. Okay, remember that not all PCOS patients will have infertility problem. Okay, out of let's say 100%, 70% maybe will have problem. Out of that, maybe 50% will require treatment. So IUI treatment, it's always we'll say 50-50, but our aim in this patient is actually to get the best follicle so that we can help them to get pregnant. So we have ovulation induction agents. We have letrozole, we have clomiphene citrate, which helps us to get. So the pregnancy rate is actually improved about 20 to 40%. Yes, Prof?
Okay. Yeah. Thanks, Vimala. So the main problem for infertility in patients with PCOS is anovulatory. So we don't need to have IUI for this patient. They can actually be pregnant with ovulation induction using clomid or letrozole. So of course, some of these patients may require IUI, and like Vimala said, is IUI success rate is actually up to 15-20%. But with PCOS and ovulation induction, yes, it can go up to 40 to 50%. That's realistic pregnancy achievement in patients who are actually undergoing fertility treatment in patients with polycystic ovarian syndrome. So Vimala, there's one question is, does having ovarian cyst increase the risk of having polycystic ovarian syndrome? Maybe you can tell the difference in ovarian cyst and PCOS?
Yes, correct, Prof. I think here we have to remember one thing, that PCOS, even though the name says polycystic ovarian, but it's more of this condition having multiple small follicles that causing this patient having problem. So ovarian cyst is a totally a different thing, that a patient might have a benign cyst or a malignant cyst, which require a total different investigation and other causes of this ovarian cyst. It can be even of physiological cyst also. So here I just would like to tell that PCOS is a different thing. It's not just the ovarian cyst as it is. But if you ask me, PCOS woman can have an ovarian cyst. Yes, that's correct.
Okay, so just to add on it, so polycystic ovarian syndrome, you don't need any surgery for cystectomy to remove the cyst because the cysts are actually small and it's less than 1 centimeter. It's 10 mm and below, but it is multiple and it's arranged in a string, like a string of pearls. So, and therefore there is no surgical treatment for removing the ovarian cyst. However, it's more to the lifestyle and dietary modification, and also treat accordingly. Like if you are an ovulatory, we can treat ovulation, or if you got hirsutism, we can treat for the hirsutism and all the hyperandrogenism kinds.
Yes, I agree.
You are quite popular, Vimala. There are a lot of questions here. What is superior regarding the infertility, ovarian during or controlled ovarian hyperstimulation?
I think this one, I think Prof. Mukhri also can help me. But for me, I think every patient is different. We can't give the same treatment for everybody. Okay, so not every patient needs ovarian drilling. Not every patient needs ovarian induction agent. So for me, if you have a problem and if the person who's typing this, you have any question, I think you can come and see us. We will explain to you more. But like I said, there is no superiority in infertility. We treat patient accordingly.
Yeah.
Yes, Prof?
Yep, yeah, you can refer to us and we will decide on which one is better. There is not actually no evidence on which one is better, but if we look at and to avoid surgical complication, we normally start with the control ovarian stimulation, which is actually easier, and the one who have resistance, then we probably can offer ovarian drilling for the treatment of polycystic ovarian syndrome. So we have another 2 or 3 minutes. So maybe we take another one question, which is I think quite relevant to us. How do you tackle patient with lean PCOS?
Yes, thank you so much for this question because I didn't put in lean PCOS in my slide, okay? Even majority of cases, PCOS are actually obese or overweight, but there are still small proportion which have normal body mass index, about BMI less than 25, will tend to have PCOS also. We call that as lean PCOS. But always remember, the management is almost the same. Why? Eventually, the pathophysiology is because of hyperinsulinemia. Even though it being thin, they will still have the insulin resistance and leading to all these problems. So basically, the medication and the treatment is almost the same. Yeah, Prof. Like what I presented.
Yeah, okay. Yeah, thank you. So the lean PCOS is those who are quite special, where they have PCOS but not obesity. And you know the Rotterdam criteria, obesity is not one of the criteria. So they might not have obesity, but they still have a polycystic ovarian syndrome. And like Vimala said, that the complications and the risk are the same as the other non-lean PCOS. So I think we need to move on to the next one, and just to answer Prof. Tengku Sarah state that nice talk, Mala, and is it higher in Asian women? Yes, it is higher in Asian women, even though when we were in the UK doing subspecialty training, all the patients with PCOS are Pakistanis, Indonesian, Malaysians. They are more prone to have polycystic ovarian syndrome compared to the whites. And therefore, it's actually more to the Asian woman, and therefore the title of this CME is the Pulse of the Asian Women. Okay, thank you very much, and I think I pass it over to my good friend here, Prof. Faisal, for the next session.
Thank you very much, Prof.